Greetings, fellow classmates and professor. This is my interview presentation from Healthcare Reform with Dr. Kiera Gillum, PharmD. Dr. Kiera Gillum has she currently is a pharmacist at the CVS in Elizabeth City, and she's been there for 6 years. Upon that job, she completed her PharmD degree from UNC Chapel Hill in 2013. Not only does she work at the CVS, but she also has partnered with local schools within the Elizabeth City and Perquimans County and Pasquotank County area on talking to the students about the opiate crisis in her area. So not only does she have experience with just working in a pharmacy, but she also tries to impact the students in the area and let them know that there is a opiate crisis involved, and it's not just things on the street. It can also be prescription medications as well. And during her residency, she also worked in the hospital and also worked at small pharmacies as well. So she does have a wide variety of experiences from both the corporate level and the small business level. One of the questions that I asked Dr. Gillum was, what effects do state health plans vary from state to state? And she explained how certain states can do different things, and as far as what they cover and what they don't cover, it varies from state to state. And she explained a situation where they had a patient that was stranded in North Carolina from New York because of a hurricane, and he had ran out of insulin. And because he was trying to get his insulin filled, but was not able to get it filled at the local pharmacy, but his coverage in New York only allowed him to be admitted into the hospital as a patient in order to receive his insulin. And I also asked what reason makes certain states do things differently. And she was saying the only difference comes from drug therapy formularities. And so that would explain the part about how that person that was in New York, that was from New York, had to go all the way to a hospital to get treated because that's what his state health plan covered. I told her I really didn't understand why things like that are done, but she just explained that those plans are different from state to state. So that was what that person had to do. I also asked her as a pharmacist what examples of how prescriptions are paid, and she was explaining to me that a pharmacy has a pharmacy benefit manager that basically has medication in different tiers. And she did, of course, explain to me how generic medicines are usually cheaper, but they're also, it depends on the type of insurance you have and what tier pays for what. She also said that the private insurance usually they usually pay for the cost of higher medicines as far as brand medicines. She also explained about how the copays and stuff may offer different savings depending on what type of prescription plans you have. So even though this is not health insurance, but your prescription plans are also part of your health insurance. So I found that pretty interesting that it doesn't really matter about what type of health insurance or prescription medicine that you have, prescription plan you have. Sometimes it also depends on the type of medicine too. I also asked her a question of how does the billing differ from community pharmacies versus hospital pharmacies, and she explained about how when a person is admitted into the hospital or even in the ER, the medication that's given to them, that medicine is not billed through their prescription plan, is billed through their medical plan, there's no way a person knows what they're going to be given. So that medication is just billed to their health insurance. versus if you go to a doctor's office and your doctor prescribes you something and you find out once you need to go get that prescription filled that something is too expensive or your prescription plan doesn't cover it, then of course you can reach out to your doctor to find something else. That's not the case when you're in the hospital. So she explained to me how that happens, and I felt like I also believe that that situation wouldn't really be fair, because in the hospital you don't really have a say so on what you can or cannot take. Is they, of course, they're giving you what they feel you need to get better, but you can get one measly pill, as far as something like a pain pill that may cost you, as a generic, a generic pain pill from a pharmacy may be like $4, versus you get one pill in the hospital and it may cost you about $50, but that's what they gave you and that's what you have to pay for. And of course your food and whatever else they give you, if it's bandages or anything in the hospital, that goes towards your medical as well. And so those were my three questions that I gave her, and I wanted to personally thank her for letting me use her for my interview and allowing me to pick her brain, because even though she works at CVS and a lot of that stuff is corporate level, but she was also very knowledgeable about the things that also happen within the prescription plans, that still does affect healthcare reform, and to, step out of her comfort zone a little bit and allow me to do these questions with her. So thank you so much. You guys have a wonderful day. Thank you.